How effective are cannabinoids in treating sleep apnea? Have you ever wondered if cannabinoids could be the next big thing in treating sleep apnea? This condition, where breathing repeatedly stops during sleep, affects millions of people. Recent research is looking into cannabinoids, especially synthetic forms like Dronabinol, to see if they can help. Dronabinol is a purified form of tetrahydrocannabinol, the main psychoactive compound in cannabis. Studies suggest that it may reduce the severity of obstructive sleep apnea. One interesting finding is that Dronabinol can lead to a significant decrease in the apnea-hypopnea index. This index measures how many times a person stops breathing in an hour. In some cases, patients reported improvements in daytime sleepiness as well. For example, a dose of 10 milligrams of Dronabinol has shown to reduce apnea events. It achieved about 1/3 of the effectiveness of continuous positive airway pressure therapy, which is the standard treatment for obstructive sleep apnea. This is an exciting development for those who struggle with traditional treatments. The way cannabinoids work is linked to the body's endocannabinoid system. This system plays a role in stabilizing breathing. Early studies on animals have shown that cannabinoid agonists can improve respiratory control. They do this by affecting serotonin receptors, which helps maintain steady breathing during sleep. However, it is important to note that the clinical evidence is still limited. Most studies have short treatment durations, often lasting only a few weeks. They also involve relatively small groups of participants. Some people reported side effects like mood changes, dizziness, and gastrointestinal issues. These were seen in about 70 to 80% of those who participated in the studies. Long-term safety and effectiveness of cannabinoids for sleep apnea are still unclear. Major sleep medicine organizations do not currently recommend cannabinoids as a standard treatment due to the lack of sufficient evidence. It is also worth mentioning that not all cannabis products are the same. Medical cannabis contains various active compounds, including cannabidiol. This compound can counteract some effects of tetrahydrocannabinol. The specific composition and dosage of cannabinoids are essential factors to consider. In practical terms, cannabinoids might offer an alternative for individuals who cannot tolerate continuous positive airway pressure therapy. However, they should not replace established treatments. More extensive and longer-term studies are necessary to understand their role in managing sleep apnea fully. Additionally, researchers need to clarify how cannabinoids affect common conditions related to obstructive sleep apnea, such as obesity and cardiovascular disease. In summary, cannabinoids representing an emerging area of research in sleep apnea treatment. While early results are promising, further investigation is needed before they can be widely recommended.